Good morning, everybody. This is Dr. Tyler Evans from Arete Chiropractic in Portsmouth, New Hampshire. Coming at you live with the Arete Chiropractic research moment. And it is just before the turn of 2019. And we have done, I think, somewhere around 20 of these videos / blogs that we've done now for the year. And it's been really interesting. Some of the information I've learned, some of the information we've shared, and it's been a really good thing, I think. This paper that I want to share today is a culmination of a few different topics, but I really believe that this topic is at the heart of what we do here at Arete Chiropractic. We are a specific upper cervical chiropractic practice, and in that, we work to stabilize the cervical spine. So the name of this paper is called Chronic Neck Pain, Making the Connection Between Capsular Ligament Laxity and Cervical Instability. A lot of big words, and I'm going to go through a lot of unique topics to our field, but things that a lot of people can relate to, and I think are good information and helpful to understand. So starting off, we'll just kind of go through some of the statistics of the neck problems that we see and how it all fits together. But the general population has about 30 to 50% of people that suffer from neck pain, with women over 50 making up the largest portion of that. 1/3 will have chronic neck pain, for lasting longer than 6 months, and 5% of the total will become disabled from neck pain. So it's a very a very large problem that a lot of people run into. In the beginning, it can be just slight stiff necks here and there, but then it can become debilitating, and oftentimes in our practice we end up seeing the people that have had problems since very little. Since they were very little, and then in their 40s, 50s, 60s, they become chronic and debilitating, and so they reach out for help. But the idea here is, if I can educate people, then they understand it earlier, we can get to it earlier, and we can fix the problem earlier. So why are we talking about ligament laxity and cervical instability? Because I think, and I believe, that cervical instability is I wouldn't say a root cause, but it's one of the pieces that is a foundational piece for why people have these long-term problems with their neck. And when we say, problems with the neck, we're talking about neck pain, we're talking about dizziness, we're talking about vertigo, migraines, inability to move, so decreased range of motion. So what are the treatments for neck pain? Most of the time it's painkillers, NSAIDs, narcotics for pain management, cervical rolls, cervical collars, rest, PT, physical therapy, manual therapy like massage, strengthening exercises, and nerve blocks are some things that people do as well, and facet injections for pain blocks. How do people get neck pain? Where does the problem come from? Well, usually it's from an injury, from whiplash, or from a slow postural problem as well. And what we find is that oftentimes short-term relief can be found, but long-term lasting relief rarely happens. And that is what we specialize here. Now, this paper is actually focused on something called prolotherapy, so I'll talk about that here. Because in this paper, what they propose is that many of the poor outcomes from NSAIDs and PT and manual therapies tend to be lacking and don't get long-term lasting relief because they're not addressing the real one of the underlying problems with neck pain and dizziness and headaches and all these things, because it's really a ligament and capsular joint issue. And so in this paper, they talk about prolotherapy. Prolotherapy is a type of injection where they take and inject dextrose or water, or saline, into the joint, into the ligament to help it repair and regrow. Because basically it wakes up the joint so that it starts to repair and grow. Well, and they actually say it really well here, but I think that applies. So I think that the whole idea here applies really well to upper cervical chiropractic. But one of the quotes from this paper is, a better understanding of the pathogenesis of cervical instability. What does it say? Instability enables practitioners to recognize and treat the condition more effectively. For instance, when cervical instability is related to injury of soft tissue like ligaments alone and not fracture, the treatment modality should be one that stimulates the involved soft tissue to regenerate and repair itself. Well, that's what we do in upper cervical chiropractic care, is we stimulate the nervous system and balance the joints so that they heal and the ligaments and tendons repair and regrow, and strength comes back to the joint. And that's what we're about. We're about stabilizing the joint rather than destabilizing the joint. We want to correct the misalignment in the spine so that the nerves, ligaments, tendons, and muscles can heal and repair around that proper posture. Let's break it down. So let's start with the anatomy. So here we have a picture of the cervical spine. So we have the skull, okay? And the skull weighs about 10 to 12 pounds, depending, and it can weigh more than that, but an average 10 to 12 pounds based on height and weight. And then we have this tiny little bone right here called the atlas, C1, which sits right underneath the skull, and it looks something like this guy right here. So this is a slice from the front, okay? So this is a slice through the front. So this would be the back of the head here. And so this is C1 right here. And it sits right underneath the skull, and it holds the head up on top of on top of itself. And so that's why it's called atlas. But that's kind of a problem because C1 only weighs 2 ounces on average, and the head weighs about 10 to 12 pounds. So what holds that joint in place is really the muscles, ligaments, and tendons around it. So what are the ligaments and tendons that are around it? When we look at the picture here, we've got all these ligaments. So we have ligaments in the back here, ligamentum flavum, the nuchal ligament. We have the capsular ligaments here in the lower cervical spine. So those all are the glue that hold things together. And so then if we break it down even further, if we take a slice, go right through the middle, we have ligaments on the inside that actually hold the atlas and the axis, which is C2, under the skull. And so these little ligaments, they attach and they hold things together. They're the glue. Now we'll break it down and explain, how those ligaments do that. But here's another slice. So this is a slice, basically the inside of this. This is a slice here where they cut open the canal. And so here we have the cruciate ligament and the transverse ligament, and these are the apical ligaments here. Alar ligaments here. But those ligaments restrict motion so that when your neck moves, the bones don't come out of place and basically injure your spinal cord, because your spinal cord sits inside of that. So then lower down we have these capsules. So the capsular ligaments that go and the discs between the cervical vertebra. So those are the ligaments and capsules that hold the joints together. Now, why is the cervical spine so important, and why are these ligaments so important? Well, it's because the cervical bones are the smallest in the spine. Sorry, I have 10 reasons why the cervical spine is so important to be stable, and why these problems arise. But cervical bones are the smallest in the spine, so that's number one. also, they are the most mobile joints in the spine. Specifically, the upper cervical joint, C1 and C2, are the most mobile joints in the spine. It's the most complex joint in the spine. And wouldn't you think, maybe that requires a specialist, an upper cervical specialist. But C1 pivots around C2 with no disc above or below. So C1 pivots around C2. So here's C2, and here's C1, and then here's your skull. So you get 50% of your flexion and extension on the top joint, on this joint right here. So you get 50% of your flexion extension, be this way, on C1, on C0, C1, so occiput to C1. And then you get rotation on C1, on C2, 50% of it. And then the other 50% comes from lower down in the spine in the lower cervical joints, down lower here. These joints down here, C3 through C7. Now, let's see, what else? Yeah, so the ligaments. The ligaments that restrict the motion that are important are those alar ligaments and the transverse ligament. So when you turn your head, you have these tiny little ligaments way up in C1 and C2 that restrict going too far. Because if you went too far, you can actually injure the cord and the nervous system that's held inside of those bones. So it's really important that we take care of that nervous system inside of that joint, because it's what communicates all the messages to the body. And then last, let's see, yeah, the lower cervical spine has the other 50% of all that range of motion in the neck. Now, lower down, the joints in the lower cervical spine have these discs, and they have facets. So they have these facets on the back, these interlocking joints that hold things in place. Now, those facets have capsules around them, which is the title of this paper. And so what we find is that those capsules get injured, as well as the discs can get injured, by the bones being out of place for long periods of time. And so what can happen is, or the way that gets that way, is you'll have either a whiplash or a concussion, like a sports injury, where those joints will get thrown out of place. And they sit like that for maybe a week, maybe a month, maybe years. Sometimes that trauma or injury can happen when we're born. And then as we go on, we have more and more of them. We have car accidents. Then we have micro traumas, like we sit at desks all day long, and we have this problem that arises called creep, where ligaments actually stretch slowly over time, and we start to have this anterior head carriage. And that's bad. It's not good, because it puts a lot of stress and pressure on those ligaments and tendons in the neck. So the answer to all of this is, in this paper, they talk about prolotherapy, so going in and injecting into the joints, which is helpful because it helps the ligaments regrow and repair. But if we can align the joints, that's going to really stimulate that repair process, not only by just taking the pressure off things, but allowing the nervous system to turn back on and start healing from basically the brain down. And that's what we do in upper cervical. And so I'll show you quickly just a few pictures of, and actually I wanted to show this too. So there are a couple different grades of injuries to the ligament. So a grade 1 injury to a ligament, so you have 3 different grades. And this was actually taught to me by Dr. Scott Rosa, one of our mentors in the Diplomate program. But this is a grade 1 problem, is basically you've had a whiplash accident, and we think about it like this. Okay, this is a grade 1 problem, where you've stretched a ligament or injured it in a way that it's all the fibers are kind of bent out of shape. Grade 2, we've done this, but then we've also done this. So it's not torn entirely, but it's really injured, right? And then we have a grade 3, where we're here, and then, yep, you guessed it, uh-oh, that's a big problem, right? So those types of injuries upper cervical chiropractic care can't help. But grade 1 and grade 2, we can definitely help because we can stabilize the joint and allow it to heal. So when we have a whiplash injury, it looks something like this, where the ligaments and tendons get stretched, right? And, you know, it can be down here, it can be a minor type injury. Here it can be, you know, a little more unstable, and then here is really unstable. And so we want to prevent that. We want to prevent that from happening. And this is actually a picture of a CT scan of a misalignment at C1. And you can imagine the ligaments that attach inside of there, that they've created a really big problem by the bones being so far out of place. And then the last couple pictures here, I just wanted to show you what a good cervical alignment should look like in the neck. So this is good alignment in the neck. This is what we want. And then this is actually what we call a reverse curve. So we want a good C-shaped curve. This is a reverse curve. Not good. No good. No bueno. And these are actually a couple of pictures of patients of mine in the office that, you know, this is a 19-year-old. So this picture actually has degeneration in it. We're starting to have degenerative changes in the spine, as well as in this picture here. So both of these patients had migraines, neck pain, back pain, and they were in their teenage years. And that can happen from football, that can happen from car accidents, it can happen from a lot of different things. But what we want to do is we want to get that normal range of motion back to the joints and get the alignment back so that the ligaments and tendons can stabilize and heal. So, you know, this is a great paper. It talks about a lot of different things. And really, in the end, what we're trying to do here is stabilize the joints so that we prevent things like migraines, neck pain, you know, dizziness, all kinds of, you know, symptoms like that. And finally, in the end, you know, if the spine is out of alignment like that for long periods, it creates degeneration, and the spine actually starts to break down. And that's what we were seeing. Even in those 19-year-olds, they had arthritis in their spine because when the joints are out of place for long periods of time, it actually starts to affect mechanoreception in the joints, which are little GPS units, and they start to send signals to repair and regrow, and it actually builds bone in places to stabilize the joint. So the body is always trying to stabilize. But if you know somebody that takes and cracks their neck a lot, they're creating a problem, and they're making it worse. By cracking their neck all the time, it's creating a bigger problem. It's destabilizing the spine. And so what we want to do is we want to stabilize the spine. We want to do it with the least amount of corrections over a lifetime to keep the body as healthy and balanced as possible, keep the nervous system as healthy and balanced as possible. So that's it. That's my podium talk for the end of 2018 here. A lot of good concepts in this paper. Really great paper. You know, if you have questions about it, give us a call. Our office is called Arete Chiropractic in Portsmouth, New Hampshire. And again, I'm Dr. Tyler Evans. I hope you had a great 2018, and we'll see you in 2019. Goodbye.